In only a few jurisdictions in Canada is this information collected in, for example, Nunavut and the Northwest Territories. Right now, they collect information on the indigenous identity.
Should Canada's health systems know what race you are? Right now, they don't, but some doctors and researchers have published an open letter saying the system needs to know exactly that in order to know who it's failing.
Data really can be used to hold systems to account. It's very hard. It's easier to dismiss anecdotes or people's experiences. It's much harder to dismiss, data that shows, that systemically certain groups are being treated differently or have different access.
The letter's lead author, Dr. Andrew Pinto, notes specifically the deaths of Brian Sinclair and Joyce Echequan, Indigenous people who died while waiting for care in hospital. Pinto says the letter took over a year and its authors were very aware of concerns about the ethics and privacy of collecting data on race or Indigenous identity. Pinto says if it happens, it must be voluntary, it can't be displayed on a health card, and there must be laws to prevent the data being sold. Most of all, Pinto says people the data comes from need to be deeply involved in how it's used.
Communities themselves have a way to access the information and are involved with interpreting it and coming up with solutions. So it can't just sit in a government database and be inaccessible to the actual communities.
It is very difficult to know whether your system is fair or not if you don't have these data. Very difficult to know. And the easiest way of collecting the data is if people do it once every 5 or 7 years when they renew their health card and they do it once.
Dr. Kwam McKenzie is in support of the idea and has written on it in the past. He notes some local health units already do this and have ways to protect data from misuse. And in terms of results, he says this data collection was how, early in the pandemic, public health learned black populations had COVID at a rate 9 times higher than white people.
When after we got the data and that was shown and we understood why, it was possible to put in focused pandemic strategies, which significantly decreased the rate of COVID, the relative rate of COVID in black populations compared to white populations, decreased it by 400%. Think of the lives that were saved by that data.
In Ottawa, Xiaoli Li, City News.